If you're feeling stuck down, overwhelmed, anxious, and in that loop that you're just struggling to break out of, and it's causing you depression, panic, or just feeling a general sense of anxiety, and you're not sure what the root cause of the problem is, then I think Cognitive Behavioural Therapy, known as CBT, can help. Feeling consumed by your thoughts and the uncomfortable emotions that come with this can make you feel very vulnerable. I've certainly been there, and you might feel fear to experience that again, which then causes anxiety and engaging in those thoughts and behaviours to ensure that it doesn't happen again. And this can certainly feel lonely, isolating, and impact the people that you care for that are around you. And at some point we all feel worried, down or stressed. It's completely normal. However, when the feelings and the thoughts feel difficult to break out of, we may need that extra bit of help. Again, completely normal. This can be treated with evidence-based therapy, CBT. And how this works is how our thoughts impact our feelings and how our feelings impact our behaviours. An example of this is if you're struggling with socialising due to a fear of being judged or how you think others see you, that can then lead you to feeling anxious, engage in avoidance behaviours or safety behaviours such as going out, sipping water, or trying to look a certain way so people can't see how you're becoming anxious or how you think they see you. But over time, by doing these behaviours, it will affect your confidence and the anxiety will intensify due to the actions following your thoughts. However, CBT will provide you with the tools, the techniques and the strategies to break out of this unhelpful cycle. And this will include changing your thoughts, known as cognitive restructuring, and your behaviours, which will then change the unhelpful feelings. Take a closer look. So Rosie sat at home, she's in her bedroom, scrolling on her phone. She knows she has a presentation tomorrow, but the anxiety is leading her to procrastinate. And instead of preparing for this presentation, she's avoiding it because of the fear and the worry that people will judge her, that she might stammer or look red, or people will think that she is overly anxious and they will laugh at her. The thoughts that Rosie usually has when she's in social situations are, where do I put my hands? Where do I look when I'm presenting? People will notice that I'm red, and people will think I'm not good enough for this job and that they will sack me. People will think that she doesn't know what she's doing, everyone can see this, and then they will judge her. And the feelings that Rosie has had was anxious, stressed, more specifically socially anxious. And as a result, she was avoiding her laptop, avoiding the presentation, scrolling through social media to distract herself. So during therapy, Rosie and I carefully looked at different situations that she felt anxious in. And by making a list of the social situations that Rosie would no longer like to feel as socially anxious in, as this was affecting her socially and occupationally, we set an exposure experiment, starting with the easiest task, working our way up to the most difficult. And this is called an in vivo exposure experiment. We tested out those negative beliefs and those negative thoughts on finding evidence whether she was judged, whether she was laughed at, whether she was going red, or whether that was more an image in her mind or a fear. By the end of the session, Rosie's confidence had significantly increased. She no longer had these intense emotions and feelings that were impacting her just to live. And of course, you can imagine this was so life-changing for Rosie. She was keen to build her career after graduating from university. However, it was the anxiety that was keeping her isolated and stopping her from studying and was exacerbating the anxiety. Now Rosie no longer lives according to what she thinks other people think of her.